Okay, so good evening, everybody. I'm sure people who are able to hear this would benefit from this talk, and it's a great opportunity for us to discuss about COVID and the other associated questions we normally, go through our mind. So now, over the last couple of years, we have all been trying to fight this, unknown enemy, the COVID, and the medical profession, especially the nurses and the doctors, along with help from the pharmaceutical industry in the form of, helping out with, various things like medications and equipments and the building up the infrastructure. I think the industry has also been played a very vital part, and the fact that we are actually nearly about 1.5 to 2 years now into the pandemic. Still, I think the evidences keep on changing. And as you know, lots of medications were once indicated, now no longer indicated. And I think that is the difficulty with dealing with this pandemic. And we are never going to be ever free of this COVID, and it's going to be around. And I think we have to have adequate precautions. Whatever we do, I think we have to be careful. We have to deal with this disease in a very careful way and make sure we are smart enough, try to get rid of the very bad side effects which COVID produces, including mortality. And so the problem with our people is like most of them have their own way of thinking. They often think people with lots of comorbidities are at higher risk for vaccination. And that's one thing I try to, emphasize people that they have to go ahead with vaccination, especially people with comorbidities like hypertension, diabetes, and ischemic heart disease, stroke, and all these people are especially more prone for complications of COVID. And people who can get vaccinated as soon as possible may, or at least, trying to avoid the serious complications of COVID. And even if they get the disease, they will usually get a milder form of the disease compared to whilst they are not vaccinated. So now lots of people keep asking about various questions, and there are certain questions I would like to advise. One of the major questions: how susceptible are heart patients for COVID infection? I'm sure people who are having more comorbidities, from our experience in Apollo hospitals in Banagaram, more comorbidities do worse compared to people who don't have comorbidities. So this is another thing we are seeing, and especially second wave, we see even people with no comorbidities having serious infection. So I think all of us are highly susceptible, especially those with cardiovascular disease, especially who have had a prior MI, cardiac failure, people who are already on, lots of medications for one reason or the other. I think we have to be careful. We have to make sure these people get vaccinated as soon as possible and, prevent the bad effects of COVID. The second question is, what do you do with medications? Is it wise to stock up medications? How many months of supply? I would say don't panic. I think we have to have enough medications, as usually we all do. Don't need to stock up. I think we have to. That will create an inequality in being able to procure the medications for other people. So I think you have to just be sensible. And how do you manage stress in this pandemic? This is a big problem, especially with the older generation of people who are used to be active, go around and meet people, go to festivals, go to family functions, and these things are now missing now. And lots of people I have seen have been serious depression, and people who are already unable to walk and get into problems like increase of cholesterol, increase of the sugar values, and people trying to avoid going out, and either by themselves or their children trying to encourage them not to go. And those people find it very difficult. Actually, you have to be in their shoes to realize how much really they struggle from this idea of concept of trying to just be jailed inside their house for about nearly 2 years now. And it's just unimaginable. Actually, as a doctor, in fact, I was actually isolated from because of personally I had COVID, and I felt like really bad, actually unable to do my day-to-day activities even for about 15 days. and I just pity these people. But now after vaccination, I think they have to follow the precautions and try to get on to be as normal as possible. That's what I tell everybody. Now, how do we to be physically active in this lockdown? I would always say being fit and being actually in a very good both physical shape wise and also mentally helps a lot in beating any disease. For that example, even if you get fever, even if you get a heart issue, then if you are fit, then you fight it better because you have better hormones in the body. You have the outlook is better. You don't get depressed. You can move earlier on and trying to get rid of the infection. You get lots of better antibodies in system. All these things are produced by means of good exercise. You don't need to have big area for exercising. I can even exercise in a 6x6 room with plenty of variation. I think you can do whatever you want actually. So I would say mix it up with little bit of walking. If you can go out in a safe area, or you can do a little yoga, you can do stretch ups, you can do some core body exercises, little weight training. All these things anybody can do within limits. I think you have to be as active as possible within the your facilities, whatever you have. So what about the diet in this pandemic? So I would say it's not anything specific, but try to eat plenty of proteins, cut down the carbohydrates, and try to avoid all the junk items. So lots of these people have this lockdown problem like acidity, heart, chest pain. So you have to eat healthy, eat a little, and then do plenty of exercise and keep moving. Don't sit in one place. Then plenty of green vegetables. Immune building system is because of a lot of proteins you have to eat and vitamins you have to eat, and that will help you to fight the infection or all the other ailments we have. So what do you do before skipping medications or changing medications if the doctor is unavailable? So now we are fortunate to have lots of online consultants who can deal with your questions. And I have all the, for example, me and my colleagues have all the areas you could contact us, like WhatsApp. You could come into online platforms like Practo, or you can come in, Apollo's, online platform. So you can get it, or directly call your doctors if you can, or call the clinic and speak with the secretaries and try to get some idea. So you have to look after your health. I have seen lots of people having major issues, trying to hide or trying to resist going out and ending up with a big heart attack and even losing lives actually. So this has been a problem. How do you monitor your heart health at home? So if you have, I think better to have a pulse oximeter, as we all do. You have, I think all of us should have a blood pressure monitor at home, and you can just have an on and off consultation with your doctor also. So just to make sure you're doing the right thing. If you want to do some basic tests, there is lots of areas you can book for a home visit of the phlebotomist or whoever can come and get some bloods and give you the results online. So all these things you can use. What about signs of any chest pain or anything? Don't ignore. I would say the major issue is like ignoring the health and thinking like it might be dangerous. It might be dangerous just to sit and do nothing. Lots of hospitals are very safe. They take all the precautions. You have to try to seek the help of the doctors at the hospitals and try not to ignore the health actually. So to sum up everything, I think we have to have a healthy lifestyle, do plenty of exercise, eat healthy, have a positive attitude in mind. Always think that you don't think you are losing, don't get enough money, you can't live the life what you wanted, you can't go on holidays, you can't go and see your friends. Just stay alive, I would say. That is the main motto during this very bad period what we are going through. But don't need to get downhearted or depressed. I think we have to make sure that we tide the crisis in a very positive and very smart way before we can come. We have plenty of time left for us to gain our health and gain our all the things what we need actually in the future. So now, what are the myths and facts what we normally hear? So do you taking heart medication, does it make you more likely to get COVID? The issue is not, that is not true. What we need to know is like the heart medications, in fact, protect you by making you less likely to get problems. So you have to take your heart medications in a regular way. And also, I think certain medications which we have been debated, like ACE inhibitors or ARBs. I think people who are already taking, we don't stop it, but people who we are trying to initiate, probably we tried because the COVID virus acts through the ACE inhibitor pathway. And that actually sometimes we find that if you're already the pathway is inhibited, sometimes you might be more prone for COVID. So those things, I think you can, if you have any doubt, seek the help of your doctors actually. Does heart medication make your condition worse? I've answered that no. As a heart failure patient, do I have to be extra cautious? I told that already. Actually, you have to be more cautious. The myth, now the mantra is try to get vaccinated. Get vaccinated. Don't need to routine cardiac medications. Most of them don't need to stop at all. You have to continue your medications and actually get the jab what you need for the vaccination. People who are on very very potent anticoagulants like warfarin, azithromycin, or the newer oral anticoagulants should stop it for a couple of days before you can get vaccinated. So what you have to do is like medications wise, you might need adjustment. So you contact your cardiologist or your general physician or your known doctor to get this idea. I get worried and stressed out sometimes. Do I need to consult a psychiatrist or therapist? If necessary, yes, why not? But most of the time, I think good thought process with good sleep and good exercise, I think builds up good hormones in the body. And you can beat all these blues with, positive attitude and, good lifestyle modifications. After the first dose of vaccination, can I do social visits and attend family functions? So this is a big problem actually in Indian circumstances, because social visits and family visits are part and parcel of a day-to-day routine, like temple visits and all these things people are badly missing. But without getting fully vaccinated, I would say avoid all these things and you get fully vaccinated first. And then even then you have to be very much following all the precautions, maintain social distancing, try not to eat out too much, try to wear a mask and all these things you have to follow. Make sure wherever you are going, you do make sure you are mixing with people who are already vaccinated and not carrying the virus. So those things you have to be careful about. After recovering from COVID, our body produces antibody naturally. So this is again, the people think after having antibody, they don't need to be having any precautions. They go out without a mask, try to go and stay in hot places, all these things. So the vaccine doesn't 100% protect us. So we have to be cautious. It might make the immunity is there, but you might still get infected. And if you're unfortunate, you might get complications. So be careful. COVID vaccine gives lifelong immunity. Again, that is not true, because usually the vaccine or the COVID infection gives you about 6 to 8 months immunity. That is the studies is what it shows actually. So after that, we might need a booster vaccination every year. So I think we have to, that will be coming out soon actually, the guidelines for that. So it doesn't give lifelong immunity. And what about the type of masks we wear? Actually, I think a cloth mask or a normal surgical mask is enough, but healthcare workers often we have to wear an N95 mask, and we work in very difficult circumstances. We have to talk for a long time. We have to work in a COVID ward without air conditioning, and especially the nurses, even doctors just go and come, but the nurses stay there for the entire shift of 6 to 8 hours, which is a very bad scenario for them. So be supportive to doctor colleagues and nursing colleagues and understand what they are going through. And I hear lots of violence against doctors in some parts of India, and all these things I think should be very strongly addressed and condemned actually. And what about the vitamins and all these things? I'm sure this vitamin things might help, but I don't think that they can't be just be the protection level is not really going to be enough for us to get rid of COVID or fight COVID without like an immunity. It can't do that. So what we have to do is like we have to make sure we get immunity by other ways. Like somebody is asking that how do you get immunity? Immunity is you get immunity by working hard with your fitness, and that is one of the most important thing. For example, I am actually, try to work out every day. I think people who know me know about that. And I got COVID. My lungs were about, 2/3 gone. And the scoring was about 20 out of 35. And I didn't have any symptoms. No symptoms, only fever, but no breathing issue, nothing. And I actually had some injections and I had to, just for, getting rid of the infection. But symptoms wise, I was completely normal. I was just like a normal person. So I think if you're strong, if your baseline immunity will be very high, eat the right things. Don't eat junk and don't eat sweets and, all the packaged foods and all these things will bring down immunity. Eat healthy, and those things are very important for us. And what about procedures? So, for example, lots of people want to have certain surgeries or operations done. People who actually, for example, have a heart disease, want to have a bypass done, for example. So normally all the precautions are taken care by the hospitals. People who actually want to have any type of surgery, I think will give me 1 minute. So I think we'll actually can have it done in a very safe manner now. So you have to get properly tested, make sure you are immunized against COVID, and you get tested again that you are not having an active infection. And again, you go ahead with the surgery. And usually it's you're commonly doing all the procedures now without any side effects or complications especially because of this COVID now put in this scenario. So I would suggest that whatever it is, if it's an important thing, don't have to hold on to it. You just go ahead and get it done under expert guidance. What about people who are waiting? People are waiting just for any heart procedure or anything like that. Then you have to make sure that that you actually monitor your symptoms of heart and make sure you are not getting sick or unwell before seeking help. You have to seek help early. So some people are asking, how do you take any precautions because of people who have cardiac issues? So cardiac issue patients especially be very much disciplined. I tell every patient of mine, maintain discipline in life to come up or be successful in whatever it is. You can fight any problem if you're disciplined, actually. So take it as a challenge and make sure you actually, fight. Don't be afraid. Being afraid and being stressed up is a very negative quality. It's not a godly quality. You make sure you have a positive outlook and make sure you're disciplined, sleep well, eat well, and make sure you do plenty of exercises. And those things will help you to beat the infection with strong immunity and positive attitude. Now, all these things are very important. Now, something else so somebody is asking, doctor, recent recovered COVID patients with heart attack history, what? Because so see, COVID is a disease. It's actually causes lots of misdirected immunity in the body. Interleukins, cytokines, all these things can get very much revved up and cause havoc in the body, and all the immune system can get really affected. One. Second, it's actually clotting disorder. Actually, it can cause clots everywhere. For example, it can cause, I've seen people developing cerebral venous thrombosis. Like I've seen people with pulmonary embolism. I've seen people clots in the heart, heart attacks. Lots of people have heart attacks, chest pain. A lot of people have DVT, pulmonary embolism. So lots of people losing a limb, peripheral arterial disease, you losing a limb. So I would say people who are prone, then you better to have anticoagulations or antiplatelet agents depending on what your doctor prescribes. So all these things would be helpful. You might need them to take them for 3 to 4 weeks or at least 1 month. Some people even take it for 2 months, and low dose of anticoagulation would help. So this is one of the advantages of people already who are taking aspirin and the clopidogrel. For them, the side effects might be less because of this clotting phenomenon. So those things should be taken care of. So I would say, so like again, same people asking if low dose aspirin is needed as a precaution post-COVID. Like I said, it might be needed if you have a clotting phenomenon. So vaccination wise, I think now that should be the where we should be concentrating. So you ask your colleagues and friends and your family that whether they are vaccinated. It should become compulsory, I think, for all of us in a safe way. I think we should all get vaccinated, and all the vaccines are very good. I see there is some clotting issues in some of the vaccines, but if you take adequate precautions, get a proper checkup if you want to before get vaccinated, so that you're not getting. So, for example, people are already suffering from any cough, cold, fever, and those people should not get vaccinated. They should get rid of the infection before they get vaccinated. So, try to be sensible and don't rush into things, but still make sure we all get vaccinated by the end of this year or early next year, so that we can fight this infection in a very positive way. And the common questions I'm asked is like whether I am a heart patient, am I not vulnerable for vaccination? It's the other way around. If you're vaccinated, then you are less vulnerable due to COVID infection, rather than trying to avoid the vaccination and being afraid. People who are very much old often think they don't get out of the house, and they don't need vaccinated. This is my day-to-day discussion with all my patients. Even if you're not getting out of the house, you have people coming in to clean your house, people visiting you, or you might need to get outside to get some food. If people try to deliver things for you, for example, all these could be sources of COVID. So whatever it is, whether you are going out or not, you have to get vaccinated. And I think diet has been addressed already. Actually, I think we have to eat a very healthy diet rich in proteins, so that we have to boost the immunity. Proteins and vitamins, I think that boosts the immunity. Don't eat lots of fatty things. Some people eat the egg daily with the yellow in it, so try to avoid that. I think you can take out the yellow. One person is asking, how should patients with cardiovascular conditions manage workplace exposure? For example, if you go to work, you go in a very safe way, get vaccinated before joining work. If you're not, then be careful, wear a mask, and try to maintain social distancing. Try not to eat outside in the canteen. You take your own food and eat. That might be a good way of preventing infection in your workplace. So I think we have covered most of the things, and if there is any other questions, I think we'll go through that and have a look. What is the link between hypertension and COVID? So I think I told about that. There is a link. The way the COVID virus access through the receptor for the ACE inhibitor. So I think sometimes when you give medications, it can make you more prone for because the receptor, there are more receptors as a compensation when we use ACE inhibitors or ARBs. There are more receptors, compensatory receptors are being produced, and can make the virus pathway easy. But I don't think there is strong evidence or categorical evidence to tell that we have to stop these medications. People with very high blood pressure can make it more prone for COVID complications. So you have to control your blood pressure well. At the same time, medications wise, I seek the help of your doctors, but don't need to really switch or change most of the times. I am keeping all my patients on the usual medications. Even if they are already on ACE inhibitors or ARBs, I don't stop them. Okay, I think people should have got the message. It's about half an hour of talk. Any other questions? I think I'll be more than happy to answer. Again, anticoagulation, I think there has been good evidence to say that people who have higher risk benefit from anticoagulation. So two things I have found to be very useful, especially people who have severe infection or ICU related infection. UK study showed that steroids, they're life-saving, but even we use it for with under supervision in a short course would not really benefit. There's been a lot of talk about mucormycosis, black fungus associated with steroids, but we have used steroids for a long time, especially with lots of rheumatological issues, and they don't really cause mucormycosis. I think the link is between severe COVID infection and mucor rather than steroids, but steroids can obviously make people a little bit vulnerable. So anticoagulation especially is needed in especially indicated patients. Physical exercises, again, somebody is asking. Physical exercises we have actually addressed in our talk. I think you can mix and match. Try to do lots of cardio type of exercises, which will be helpful. Try to be gentle. Breathing exercises will be helpful. Pranayama type of exercises. Try to do lots of flexibility yoga type of exercises, so that you don't get stiff. And then you can do lots of little bit weight training also will be helpful with core body exercise also. How to prevent COVID-induced atrial fibrillation? Prevention of COVID-induced atrial fibrillation, you have to treat the disease early. If you already have a tendency to AF, then you might just need to be regular on your medications. But otherwise, I think I've seen people going on sinus tachycardia, AF. I think once it comes, it's treatable. Once the disease cures, it settles down. So don't need to worry. Okay, I think we have done enough discussion. If everybody is
Yes, sir,
happy,
all the
we can-
questions have been covered, sir.
Yeah,
Thank you, sir.
I think we have done well, and I thank people who have patiently listened to this, and I thank the organizers for inviting me, and thank you very much.
Thank you, sir.